Welcome to this edition of AFMC.
I'll tell you how I got better. I'm
Glad to be here.
A mission to
Delivery of
improve.
I think that we're going to talk about everybody's.
Arkansas is the second highest prescriber.
Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Dr. Atul Kothari, and he's an infectious disease specialist in North Little Rock and is affiliated with Baptist Health. Dr. Kothari, thanks for being here.
Thanks for having me, Robin.
So we're talking about Antibiotic Awareness Week. Tell me what that is.
So Antibiotic Awareness Week is just what the name suggests, an awareness about antibiotics. As you know, antibiotic resistance has been rising over the past several years, and CDC came up with this Antibiotic Awareness Week, which is every year the same time, November 18 to 24th, and they have a series of events to raise awareness about the issue, both amongst healthcare professionals and the general public.
And so why is something like this needed?
Well, we kind of take antibiotics for granted all the time, and we always go to the physician asking for an antibiotic, but antibiotic resistance is on the rise, and it has been on the rise for over a decade or so. And Antibiotic Awareness Week is just a way to focus attention, kind of cut through all the noise which we have around us in healthcare all the time, and focus attention on antibiotic awareness, kind of talk to both providers but also patients and caregivers, because the best way to reduce or tackle antibiotic resistance is if everybody asks for less antibiotics for viral infections.
So why is it on the rise? I mean, why are we seeing that climb? And is it just in Arkansas?
It's not just in Arkansas, it's actually a worldwide phenomenon. Now, antibiotics have a very interesting history. Like when penicillin was first discovered in 1928, it was just discovered by accident. And then we found it was a wonder drug, it helped in the war, and Sir Alexander Fleming actually got the Nobel Prize for discovering penicillin. But even when he was accepting the Nobel Prize, he said it's very easy to develop resistance. And bacteria can develop resistance to antibiotics if you give it in the wrong dose or if you give it too inappropriately. And we've been kind of seeing that all the time since then, that we have a new antibiotic, bacteria become smart, become resistant, and a new antibiotic class comes around. And it wasn't really a problem throughout the 60s, 70s, and 80s. We were kind of playing a game of whack-a-mole. Whenever antibiotic resistance arose, there was a new antibiotic class which was discovered. But since the 90s, we really haven't had too many new antibiotics come up, especially antibiotics which can be taken by mouth in the general community, in the community setting, in the outpatient setting. And that's why the focus by CDC and by other organizations to start talking about antibiotic resistance, focus attention, so we maintain the antibiotics that we have for future generations to come.
And so when we say that it's on the rise, is it antibiotic resistance is on the rise? Is it because people, just their doctors are prescribing it too much, or people saving it? Like, what do you mean, and how does that affect the community?
So I think it's going to be a combination of things. Like I said, bacteria by their nature are smart and they develop resistance. That's expected. But we also have a lot of antibiotic prescription which is happening. There's some data out there which says that about 30% of outpatient antibiotic prescriptions are probably unnecessary for viral infections and other things. So it's a combination of both.
Well, it's so interesting. And what is especially important for PCPs to be aware of, and how does that affect their practice?
I think it's important to think about antibiotics when you prescribe them. After all, antibiotics are life-saving drugs. So you don't want to withhold antibiotics if somebody needs them. But like I said, there's data out there that antibiotic prescriptions in the US are about 30% more than more than what should be. And Arkansas is actually faring pretty badly. So we are probably another 30 to 40% behind the national average in terms of antibiotic prescriptions. The national average is about 700 antibiotic prescriptions per 1,000 people every year, whereas in Arkansas it's over 1,000 antibiotic prescriptions per 1,000 people every year.
Wow.
So for PCPs, it's really talking to the patient, thinking about the patient, kind of thinking about, does the patient need an antibiotic or not? Could this be a viral infection that I'm dealing with? And does the patient need 10 days of antibiotics, or can he do with a shorter course of antibiotic?
So you touched about Arkansas and where we rank nationally. What is the solution, or what do you see as ahead for antibiotic awareness and use?
I think being aware about antibiotic resistance, both amongst primary care doctors, physicians, and practitioners, but also generally in the community, is a really good idea. Some of the best work I've seen comes actually out of AFMC's work in Medicaid. You have like cartoon posters out there teaching kids about antibiotic resistance. One of the hardest things I find in practice is when a caregiver comes in, they want their loved ones to feel better. And there's often a lot of pressure on prescribers to prescribe antibiotics just to make somebody feel better. And that's where I think everybody has to take a deep breath, think about the patient, think about, does the patient really need an antibiotic or not? There's new diagnostic tests which are coming up. We need better diagnostic tests which are able to differentiate between a viral infection, which don't need antibiotics, and a bacterial infection, which do need antibiotics. After all, we were able to do a lot with COVID, during COVID, and there's new diagnostic tests which continue to come up, which I think hopefully will make it easier for practices to make that distinguishing, to make that change.
And so when is Antibiotic Awareness Week, and how do providers and community partners learn more about it?
So Antibiotic Awareness Week is November 18th to 24th every year. The CDC has a series of events and workshops designed every year. Arkansas usually does Antibiotic Stewardship Summit in that week. This year, it's not in the same week. It's actually going to be in February 2025. But that's a great way to get engaged as well. It's got CME credit. I think it usually has some nursing credit as well. So it's a great way to get engaged with antibiotic stewardship or antibiotic resistance, find out more about it. We have a bunch of speakers who come from all over the country to speak on that day.
Well, Dr. Kothari, thank you for talking about this important information and all you do. Thank you.
Thank you, Robin. Thank you so much.
And that's it for this episode of AFMC TV. Thanks for watching and have a great day.